With coronavirus again spreading its wings in Europe and several other countries in what is being billed as second wave of the pandemic, all eyes are on vaccine development now. While vaccine is still a far-fetched expectation for most experts of the world, in India, an expected arrival of the vaccine has already become a hot poll issue. Hello and welcome. You are listening to Town Post Podcast, this Sunday, October 26, 2020. This is one vaccine that is perhaps the most awaited the world over, since after those for smallpox and polio. However, it is still very uncertain and unpredictable. Although more than 100 vaccine candidates are being tested in different laboratories of the world and are at different phases of development, it is still too early to say that humanity would succeed in its quest for a perfect weapon against one of the biggest pandemics in recent human history. Vaccine has become a hotly debated subject for most of the countries in the world. Meanwhile, in a good piece of news coming from UK, it is being said that the staff at a major London hospital trust have been told to be ready to receive the first batches of the vaccine being developed by the University of Oxford and AstraZeneca. Reports say that the hospital was told to prepare for the vaccine from the week commencing November 2nd. A vaccine that works is seen as a game changer in the battle against the novel coronavirus, which has killed more than 1.15 million people, hammered the global economy and shattered normal life across the world. The Oxford vaccine is expected to be one of the first from Big Pharma to secure regulatory approval, along with Pfizer and BioNTech's candidate. However, there are many experts who feel that a vaccine would not be possible for everyone till a few months into the next year. Only yesterday, Dr. Anthony Fauci, the director of the U.S. National Institute of Allergy and Infectious Diseases, said experts will know by early December whether a potential coronavirus vaccine is safe and effective, but widespread availability will probably not happen until next year. He said, the amount of doses that will be available in December will not certainly be enough to vaccinate everybody. You'll have to wait several months into 2021. Meanwhile, in another good piece of news, it has been learned that AstraZeneca's vaccine has produced a robust immune response in elderly people. Reports say that the vaccine, which AstraZeneca is producing, in collaboration with the University of Oxford, produced protective antibodies and T-cells in older age groups. The elderly people world over have been found to be at the highest risk from the coronavirus. And it is important to know that a potential vaccine protects the elderly population too. Back in India, vaccine has become a hotly debated electoral issue. While the NDA leaders have promised free vaccine for everyone in the elections, today the Union Minister Pratap Sarangi had to clarify that all people of the country, and not only those from Bihar, will be given free COVID vaccine. The BJP promise of a free COVID vaccine for Bihar, where assembly polls are slated to be held this week, had caused a political storm as the opposition parties flayed it, saying that it was taking advantage of the pandemic in elections. Meanwhile, there are some experts who are also cautioning against showing any haste in the development of a vaccine. They feel that any haste may prove dangerous for a large number of people, and safety must be given utmost importance. Experts have pointed out that vaccines, which are developed slowly, are more effective in long term than those which have been rushed through. So, while the entire world is keeping its fingers crossed, we at Town Post sincerely hope that the humanity does find a solution to this deadly disease, and provides relief to crores of people who have been forced to live under full and semi-lockdown conditions for several months. You were listening to Town Post podcast focused on coronavirus vaccines. We will soon be with you with another episode. Have a nice day and stay safe. Goodbye and take care of yourself.